I will now tell you about some of the continuing dilemmas, unresolved issues, and needs for the future within children's mental health and child welfare. The first problem is that there is insufficient funding for children's mental health services. This is a problem that will not likely to be resolved anytime soon. There is also a shortage of well-trained mental health professionals, especially child and adolescent psychiatrists, which compounds the problem of access to diagnostic assessment, medication evaluation, and multidisciplinary team coordination. Overworked child welfare employees have little or no time to assess need and make referrals, especially in the investigative phase of involvement with child welfare when the priority is on child safety. There is a failure to provide child welfare staff with sufficient mental health training to develop adequate case identification skills, and there is also a need for multi-system interventions and coordination of services by child welfare, a further demand on time and expertise. The collaboration between child welfare and children's mental health is one that needs to be emphasized. Both fields serve overlapping populations and have a common goal of serving children in the most home and community-like setting possible. There are several barriers to successful collaboration. There still exists a pervasive pro-residential bias among mental health and child welfare professionals and also among legislators. Child welfare agencies are often highly skeptical of the mental health system's capabilities. There must be created opportunities for both policymakers and workers to talk to each other to build a common language and a common philosophy. Service funding is largely inflexible, which is another barrier to collaboration. Moreover, significantly more money is available through both the child welfare and the mental health systems for out-of-home placement than for non-placement alternatives. Most insurance policies tend to cover residential care, but not non-residential care. I will now talk a little bit about future directions in practice, policy, and research in children's mental health. First, in practice, there needs to be increased access to care. This can start by informing child welfare workers about the importance of early identification and treatment. Also, it can be done by instituting a standard protocol for screening and assessment to identify need for mental health care on entry into the child welfare system. There needs to be consistent mental health practice across counties, and child welfare workers need to be educated about local resources and creating a liaison with mental health providers to facilitate rapid referrals into mental health services. There also needs to be monitoring of referrals and following up to ensure children and youth receive the services that they need. There should also be an integrated model of care which could influence access to treatment. For example, locating mental health professionals in child welfare agencies may be beneficial for these two fields. Furthermore, there needs to be a move beyond usual outpatient and institutional care. We must examine evidence base for interventions to treat common clinical conditions and more complex conditions. We need to assess availability of evidence-based interventions at the local and national levels to assure relevance and explore adaptations that may be needed. We also need to identify candidate evidence-based interventions to meet mental health needs at the local level. Once solid evidence-based interventions are identified, there needs to be an increase in the use of these interventions in child welfare. We must track progress of up-and-coming mental health interventions to determine their readiness for large-scale adoption, learn about the challenges of intervention adoption, and consider additional candidate interventions for implementation within child welfare, in contrast to those more likely to be provided in the mental health system. For evidence-based interventions that require the expertise and resources of the mental health system, we need to develop a partnership between mental health and child welfare with clearly explicated roles of each system, and preferably with joint child welfare and mental health and Medicaid funding. There also needs to be system-level linkages that require quality review to ensure appropriate referrals, application of evidence-based clinical care, and retraining of mental health specialists. Future directions in policy tend to focus on funding issues. There needs to be a shift towards reimbursing clinical interventions with evidence of benefit. Also, the leadership agenda needs to include disseminating interventions with a strong evidence base, and also providing initial training of clinicians and continuing medical education for experienced clinicians. There also needs to be collaborations for supportive federal agenda. There needs to be changes in funding streams and more flexible use of funding to provide better access to mental health services for children in child welfare. More research needs to be done on evidence-based practice in children's mental health. Studies on how best to deliver treatment in a variety of real-world settings need to be conducted. Also, research on how to sustain effective treatments within communities is another area that needs to be addressed. Clinical practice is another thing that needs more research. Increasing understanding of current clinical practices that make mental health services more or less effective needs to be explored. Also, service system organization, or access, costs, and satisfaction with care, is another area that needs more research.
In ending this presentation, we'd like to reiterate a few points. Mental health is a key component in a child's development. In order for children to lead productive lives, they need to be able to learn and grow. To do this, they need to be healthy physically as well as mentally. For children in the child welfare system, trauma plays a significant role in contributing to their mental health. Yet the mental health delivery system in the current state does not sufficiently meet the needs of these children and youth. We believe, with a combination of evidence-based interventions, support and services, a consistent, systematic approach in assessment and collaboration, the mental health and child welfare system can become better equipped to help children and youth with mental health problems, or those who are at risk, to thrive and live successfully. What this also means is that there needs to be policy changes to how children and their families access the mental health services. We hope our presentation on children's mental health today has provided you with some knowledge and understanding of trauma and the impact it has on a child. It is also our hope that this presentation will motivate you as social workers to make changes in your practice to more effectively address children's mental health and increase communication with other systems that you work with. Thank you.